Good afternoon, Toomas Silla. We are together today to speak about the Estonian experience in implementing IDMP. And you are the Estonian State Agency of Medicine is part of the UNICOM project. So maybe before everything, you are the development manager. So what is the role of the development manager within the agency, Toomas?
First of all, thank you very much for giving me this opportunity. As said, my name is Toomas Silla and I work as a development manager at the Estonian State Agency of Medicines. And my role is actually lead all the IT developments we have in our institution. Of course, I don't do it alone. I do it together with my team, which is not that big, but we also get some support from the ministry's IT house. So our institution is a government agency under Ministry of Social Affairs. And if you look at our institution more like broadly from the point of view of the Estonian healthcare system, then in addition to being responsible for issuing marketing authorizations for medicinal products, we are also structured medical products data provider to the Estonian healthcare system. And this also includes the pharmacies.
Thank you very much. So, Toomas, when the UNICOM project was prepared, you've been approached to participate in the project and you accepted. What was the main motivation for you to be part of this adventure?
Yes, just to be precise, actually, I wasn't working for the agency when we were approached, but I think the main motivation for us to join the consortium was the opportunity to learn from each other, because this consortium has a very broad knowledge and experience base. Opportunity to learn from other national competent authorities, as well experts from different fields. So basically, this consortium gives us opportunity to be at the heart of all this knowledge and experience.
Mm-hmm. And you are often seen among the European NCA as the ones who, which is driving IDMP implementation the furthest on the road, I would say. So how would you explain that?
Yes, indeed, we probably are a bit ahead of other agencies, and that's at least partially because of our current medicinal products database is actually kind of like a legacy system. It is very old. It was developed as early as 2001. And actually, one point we decided that we have to renew it. And then we decided that, okay, if we're going to do it from the scratch, then we should use the ISO IDMP. And that's probably the case why we are a bit ahead of others.
Okay.
Because at the moment, yeah, we started this development already in May 2020. And by now we have reached already to the users acceptance testing phase. And if everything goes well, then we will introduce a new information system at the end of July this year.
Mm-hmm. And well, when we look actually at indeed the three implementation scenario, 3 approaches chosen by NCA. Some have, like you, and you are one of the few ones who have done that, indeed, who have developed a new database based on IDMP from scratch, while the others have been sometimes have chosen sometimes different approaches, like extending the database models to natively store data in IDMP format, or adding a transformation layer to create IDMP representation. So indeed, you are probably very well placed to explain to other NCA the challenges that you had to face and the questions that you had to solve actually in creating this this full database. So what would you be your key messages to other NCAs?
Yes, indeed. I have to say that we have faced some challenges during this journey. As said, we are actually a very small authority, around 100 employees. And I think the main challenge for us has been, for a small authority, are in terms of resources, both in terms of people and money. But fortunately, the UNICOM project has also helped us here. So we have been able to hire a full-time data manager or data steward who actually is organizing all the legacy data and mapping it to the SPOR data. That has been a great help. And we also received some funds for the development work. So I would say the finding enough resources has been quite a challenge for us. So if I should recommend something or give some suggestions, then definitely plan enough resources for this implementation, or even for this preparatory work, because it takes some time, because it's IDMP itself. It needs some learning, and there is some learning curve. So yeah, prepare time and enough resources.
But that's exactly what I wanted to refer to. Sorry. And I wanted to refer to, because actually the learning curve is not that easy. And what have you put in place in order to train all those new resources that you had to bring on board? What did it concretely mean in integrating and informing, for example, all the business departments in the agency and so on?
Fortunately, our project manager was very, still is very, I would say, good expert on ISO IDMP, and she has taught the other or entire agency, basically, let's say, including developer. And I would say that also if you start to develop the IT system, then you cannot underestimate the importance of the developer, because they have to basically learn the IDMP themselves as well. So
that's also a very useful contribution. As you know, within UNICOM, we are trying to develop now an educational framework for IDMP. So where we are defining levels, and we try to see who is concerned by each level. And so within the NCA, so that we can hopefully have in the future an evolving educational framework for IDMP. And I here again think that your experience is going to be extremely valuable in constructing this curriculum. I would like also you to maybe reflect on the fact that Estonia is a relatively small country. I would say, in comparison with other European countries, it's more like a region, right? And but for a drugs agency like yours, I mean, the work is basically the same than the work which needs to be done by major countries like France or Germany, just to name them two, for example. While those agencies are claiming they are under very, very high stress relating to the use of resources and so on. So do you think that the fact that you are a small country has been a real impetus also for you to try to link the different use cases, not only authorization, but thinking beyond that and thinking also beyond borders, I would say?
Yeah, I think it's, linking all different resources is of course very important question when we think about implementing ISO IDMP. But I think that the reason why we are maybe also moving a little bit faster than some other countries is because of our digitalization in general, because we're a very digital country. We have had e-prescription for more than 10 years already by now. So I think this background gives us some advantage over some other countries, because all the end users are actually already used to be connected to different resources and query data from different databases and different sources. For example, we provide all this medical products data to our medicinal products registry, and all other healthcare providers actually are querying this data from us. So if we now will provide this data in ISO IDMP model, or according to the ISO IDMP, it's for them it's let's say the connection is already made. For them it's easier to have this new data in their system.
So that means that your agency has fully integrated the need to support not only the very strict use case linked to your business, I would say, but also the other business that needs to be supported by the wider e-health ecosystem, I would say. That's what would you say, right?
That's exactly the case. That's exactly the case. Because, yes, basically we are providing data for all healthcare providers in Estonia, including e-prescription system.
Okay, so and that means also that you have developed a common vision with the other providers of information relating to drugs, like, for example, the entity responsible for reimbursement and so on. You are working into an integrated system, right?
Yes, that's exactly the case, because we also have this reimbursement rate, so that the information is actually also in our registry. So end users actually query the data from the same database or from the same source.
Okay, and how do you see the distribution of those data to the end users? What are the communication channels that you're using or with them?
So basically, we have information systems talk to information system directly. So basically, it's kind of like the direct link, the link between information systems. I kind of simplify it, but in principle, that's how it is.
So they are directly connected to the source, I would say.
Let's say.
Yeah, that's so the EHR systems used in Estonia are directly connected to this. So, okay, that's very clear. Do you see in the near future possibility to use that, for example, for the drugs, the Estonian drugs database, to connect also to external sources and use support, and this could be also supported by IDMP, for example, drugs interaction or some kind of intelligence, which could also be brought inside the database?
Of course, why not? I mean, in principle, our data is available for everybody. So whatever is the use case, you are actually able to query data from our database. Of course, there is this ministry's IT house who is more like responsible for all the technical part. But in principle, the data is available for all end users, whatever the use case is.
And then, Toomas, if you allow me, we know that all European states are also under heavy financial stress, and there are many priorities for national drugs agencies and so on and so forth. So would you say the UNICOM project is also supposed to support somewhat the agencies in starting their IDMP journey? If you look at the financial resources needed, what would you say UNICOM has brought as a percentage to the efforts in comparison with the total efforts needed to start this implementation in your agency?
Yes, as I said, we got some funds from UNICOM from the development work. I would say it's roughly 1/5 or 1/6 of the total we need for the development. So it's not that much, but still it has helped us a lot, because with this kind of developments, there is always some unexpected things happening. So you have to have some buffer for the resources as well. So having this opportunity to get some funds from UNICOM has helped. Actually, it has given us some more flexibility, I would say.
And you didn't have any problem to convince your government to allocate the necessary resources to make that change. The business case was clear from the beginning and acceptable.
Yeah, I mean, I would say so, yes, because although the main reason probably was the legacy system we had, because that had to be replaced sooner or later, and this implementing ISO IDMP was like extra boost, I would say, to do this work.
Okay. Okay. Thank you very much, Toomas. I think maybe one last question. In a way, also implementing IDMP is also learning how to use fire. And what is your your feedback? What is concerning this learning curve also in implementing fire?
Yes, fire. I have to say that when we started this development, it was completely new for us. But step by step, we have gathered some knowledge, and it's not only us. It's actually entire, let's say, e-health ecosystem in Estonia who has to learn it, including developers. So I can't say that we are experts in this field, but at least I know that we have already some experts, not in our house, but if we talk broader, then we have some experts in our ecosystem already, and that helps us as well. At least we know whom to ask if you have some questions.
Okay, and my very last question, if you allow me, is related to what UNICOM hopes to demonstrate in the project. It's the so-called product pilot list that UNICOM will deliver and will be used actually to test to test it for the use case we have. And actually, you're again very well placed, because if we look at e-prescription at cross-border level, Estonia and Finland are today the two countries which are actually exchanging information related to drugs. That's the most productive ones. I mean, there is a flux of exchanges there. And once again, given all the work you've been done, do you think that it's an activity that you will, to which you will give also priority, knowing that other NCAs have some difficulty to do that job? Do you see you are better positioned to provide this input to the project?
I hope so. Yes, giving all this data to this PPL or product pilot list, it's challenging, and again, it requires some resources. But as you said, we are actively part of this part of the project as well, and we will continue to be part of this. Although, you know, doing this pilot is not directly our task, but we will do our best at least to give the data to the product pilot list.
I think that would be a really major contribution to IDMP and to the project. So thank you very much, Toomas, for your presence today and all your answers. That's extremely encouraging. I think the Estonian experience is showing a very good example to all other European NCAs. So thank you again for your time.
Thank you, and thank you very much for giving me this opportunity.